Okay, thank you. I wanted to just thank everyone for giving us this opportunity. I love that STAR allows everyone to kind of share about their programs, and it's great to learn a lot about what's going on in Wyoming and the, you know, the community or the partners in Denver here, because we do get a lot of patients from Wyoming, and so it's great that we can kind of share these resources and meet you all. So again, I'm Brittany Engel. I'm the manager for the Sarah Cannon nurse navigation team here in what we call the Continental Division, which is Denver, and then we actually have 3 navigators in Wichita, Kansas. And so just wanted to give that introduction. I'll let Jessica introduce herself, and then we'll kind of dive in.
Okay, forgive me, I needed to find mute. Yeah, thank you so much for having us this morning. I appreciate the coalition and the work that you all do so much, and just appreciate the opportunity to meet with you all and connect. The role that I have with the organization is I am the director for cancer navigation for HCA's cancer arm, which is Sarah Cannon of the business. So when we say Sarah Cannon and you think about who and what that is, we're going to give a little bit of background on the organization, but it is part of our kind of hospital corporation's service line, and it's the cancer service line of that. We have the Continental Division, which includes 6 facilities in the Denver metro area. And then we actually also support a facility that's in Wichita, Kansas. Continental Division's reach is really across a 5-state region. So it includes Wyoming, it includes Utah, it includes New Mexico, it includes Kansas. I'm forgetting a state. And so it really is an enormous region. And we want to be able to support patients throughout that region, either to be treated locally in their communities wherever possible. That's a big part of our organization's mission. And so we want to support you all in caring for your patients locally, and then wherever we can be of help in if patients do need a sort of a bigger center or more complex care center, be a resource and really partner with you for patients where they do need a higher level of care. So excited to share a little bit about our organization and how we might be able to partner in the future.
Awesome. Okay. So we'll just go in and start. Forgive me. Do we have a time reference? I just want to make sure I'm not going over.
Nope. Take as much time as you need, and then we'll use the remaining time to talk through the additional agenda points. So you're good to go.
Okay. Perfect. Thank you. So we just wanted to give a brief overview, like Jessica said, of Sarah Cannon in terms of the history a little bit. So can you all see my screen with Minnie Pearl? Is that?
Yes.
Good. Okay. Perfect. So kind of just the name, but Minnie Pearl, who is actually Sarah Cannon, that's her real name, but she was a big television and radio kind of personality. She was one of the first women in comedy we were just talking about this morning. And so she was on the most famous probably role was Hee Haw in Nashville. And she actually was diagnosed with breast cancer and was treated at one of our kind of main facilities in Nashville. And after that experience, felt very inclined to donate and gave some money to cancer research, which became the Sarah Cannon Cancer Research Institute, and then kind of grew from there into really our service line, our cancer service line. So we're now considered the Sarah Cannon Cancer Care side, and then there's still the research side. So it's really neat. We were just saying again this morning, there's a documentary out there if you guys ever want to learn about. She was, for women in general, she did a lot. So very excited to have that kind of history with us. Just to show a little bit of kind of our breadth and depth a little bit is we are globally known and actually international. There's some HCA hospitals over in London, and they do actually have some Sarah Cannon, so cancer arms over there as well. But just to show where we are in our network, these are all the main facilities that we're located and have navigation support. So I like to show this because I think still it's kind of confusing what Sarah Cannon is in terms of with HCA. So we kind of consider HCA, and I'm going to do my arm movement here because it keeps people entertained, right? But so really HCA, which is the Health Corporation of America, is kind of the overarching umbrella. And then from there we have Sarah Cannon, which is really the cancer line underneath HCA. So everything that has to do with oncology is Sarah Cannon. And so within Sarah Cannon is really where all these different service lines come out with, like navigation. So I'm part of the navigation team, and there's over 200 nurse navigators in our company with Sarah Cannon across the nation. So we're really excited. And then that kind of breaks down again into our transplant and cellular therapy programs for transplant and things like that. And then again, the research side. So I'm going to pass it over to Jessica here and talk a little bit about navigation.
Okay, thank you. So the way that our organization has modeled navigation, we're one of the first organizations to really invest a ton of resources into the navigation space. And it was a big part of the investment that our cancer programs made, is that an understanding that navigation is really kind of the cornerstone of any cancer program, but really set us apart. And I think back to kind of the starts of navigation, especially in the cancer space, because it's really been in the cancer space kind of more than, I think a lot of different service lines now have navigators, and a lot of that has been modeled from kind of what we've developed in cancer care. And part of that is, and I don't have to tell you all, there are so many different disciplines that impact a cancer patient. And so really it can feel incredibly fragmented for a patient, especially a patient who, isn't familiar with healthcare or healthcare language. I think it feels really overwhelming for someone who doesn't even know the word oncology, to then have to coordinate care with a medical oncologist, a radiation oncologist, a surgeon, a physical therapist, a dietitian. And there are just so many different disciplines that intersect for the care of the cancer patient. And really the goal around our navigation is to help reduce some of that fragmentation and eliminate that feeling of all that complexity, and remove barriers where we can to getting patients kind of connected with care as soon as possible. Our navigation model really starts at the point of a positive diagnosis. So, and really moves through supporting the patient through active treatment, at which point we sort of do a soft handoff for patients to continue life after cancer and into survivorship. We so a little bit of the difference is, we start navigation, we don't start it from a BI-RADS 5 score. We really do start it from the time we have a tissue confirmed cancer diagnosis. A lot of what we do is around education. So I think that patients often meet with their physicians and feel incredibly overwhelmed with the information. And I think, you meet with your surgeon, you take an hour of information in, and you can't help but be just totally overwhelmed with what was said. So A lot of it is the work that we do is helping patients digest that information, working with patients after those consults and after those physician appointments to make sure they understood everything that was said to them. We work really hard to ensure that patients have all the diagnostic studies in place so that they have all the treatment options available to them wherever possible. So, ensuring that a breast patient has, a breast MRI, has prognostic indicators done, to understand whether her cancer is, estrogen or progesterone receptive. Ensuring all of those pieces are in place so that the patients have all options available to them as far as treatment, and then making sure that they understand those options. Then working also to ensure that patients have any accessibility to any kind of clinical trials they might be eligible for, to move the medicine forward, but also to move the patient's participation in those kinds of new therapies forward. The other kind of critical things we do are coordinate with all of our care providers. So we are, we're not an academic setting. All of our providers are private practice practically. So what we're really doing is working with multiple EMRs, multiple care, office schedulers, multiple, systems of communication, and navigators really serve to be that central point of contact between all of those teams. And for patients, this is incredibly meaningful in that because of that communication, that fragmentation, really to have a person that they can contact that answers their phone and their calls is like really, it's just it's a game changer, I think, for the experience, the cancer patient. We also really work to, discuss patient cases across our disciplines through multidisciplinary cancer conference. And then the heart of what we do is how can we remove barriers to care? So anywhere that we can. So a big part of what we do is a distress assessment with each of our patients, looking at psychosocial needs. What barriers to care do they have, be it financial, transportation, childcare at home, cleaning services at home, you name it. Our navigators really work to remove those barriers, or at the very least reduce those barriers so that patients can get access to care. And because the organization has invested so much in navigation over time, we have been able to compile a lot of resources for patients, both locally, but also regionally and nationally. We're going to share some of that with you all in a little bit here, but that's really the heart of what we do is, we really serve as the person's cancer care person, if you will. I think a lot of what the navigators do too is not necessarily describable. It's working with patients about how to talk to their parents about what the prognosis is if the parent is a patient, how to manage some of the impacts to quality of life, things like that. So I am so proud of the work that these navigators do, and really want to just want to highlight that and encourage you all to please reach out to our navigators with any care needs. Next slide, please, Brett. Thank you. So this is kind of a snapshot of the kind of workflow that we follow. Again, we look to connect with patients at the time of diagnosis, and then we look to connect with them through every major pivotal point along the cancer care journey. So at surgery, at the start of chemotherapy, at the start of radiation therapy, and just to kind of connect with patients, see how they're doing, see if new barriers have presented, and things like that. So we across our company navigate 23,000 patients with 200 nurse navigators across 9 different disease sites, which are kind of listed below. So really you name it, most things we navigate. I know a couple of times someone from Coalition has reached out on a tumor type that we don't have listed here. I think that someone reached out on a prostate patient, which we don't typically navigate, but we are happy to still connect those patients with resources and things like that if it doesn't fall into sort of our traditional navigation pathway, just so you know. And then next slide, please. So again, you know, working through diagnosis, through definitive treatment, engaging with patients at critical transitions through their cancer journey. And, you know, our goals are to promote access, to remove the barriers wherever possible, and to facilitate communication and coordination. So really our overarching goals of the work that we do. And then Britt, I think I'll hand it back to you to talk a little bit about our team locally.
Yeah, thank you. I just wanted to highlight our navigators here. So we have two newer ones, which is why their pictures look a little bit different. But otherwise, like Jessica said, we really do a lot of focus on the complex type of cancers, head and neck cancers, neurology, so glioblastomas, brain tumors. We actually have a thoracic, or not thoracic, well, we did thoracic, but we have a cutaneous cancer navigator. So she does a lot with melanoma, Merkel cell, the BCCs and the SBCs, but then we have a program for ocular. So I've been working, Cindy and I were working together with Lisa on an ocular patient that she had reached out to back during the conference in June. So it's nice to partner, and like Jessica said, something we've been trying to do is, you know, obviously if these patients need to come down to Denver for a little more complex care, and then, you know, hand it back off to their communities. And a lot of times, like, you know, you all have great programs, and so like MedOnc and RadOnc, maybe we have like a surgeon who might do something special. And so just happy to connect with anyone who would like some extra support. The three in the bottom right are our Wichita, Kansas navigators. Oops, sorry. My mouse, I get a little hand happy. Are in Wichita, Kansas, and they're wonderful. And then, yeah, that's our wonderful team. Of course, breast cancer, lung, GI, complex GI, liver. We do liver transplants down here, as well as colorectal and things like that, and GYN. We have a gynecology, oncology experts who do the surgery and the chemo. So we're really proud of our team. A few other things.
Sorry, there was a question in the chat box about that before you move on, and it says are they all spread over but funded by Sarah Cannon program for the navigators?
So they are all they do sit just in the Denver area. So at our 6 facilities, they're sprinkled out through the different facilities. We are Sarah Cannon employees, so we are hired through and funded, I guess you could say, through Sarah Cannon.
So
does that answer the question?
So sorry, this is Pat. I have such a bad cold.
Yeah,
my cold face. But so they're all, so you guys are one, you work together. I know you started with your hand motions, and I'm just trying to figure out, get my head around, like, do you guys meet together? Like, do you have like once a month meetings where all the nurse navigators from the whole area get together, and then the two of you oversee all those nurse navigators? Or okay, so they're spread all over, but they're under one structure. And so if I wanted, so I'm a clinical social worker. If I wanted to, and I work with a lot of cancer patients doing therapy. If I wanted to refer like a breast cancer patient to one of you, how would I do, like, maybe you're going to get into this, but like, I noticed they're like, how do I do that? Because they're spread all over. Does that make sense?
Yeah, it does. I think it's a really good question, and it's sort of a confusing to concept. So we're employed by our hospital system, and I think that, you know, and it's a free service. So it's a free service to the patients. It's free service to the providers. There's no compensation, although there is some legislation moving forward through CMS to have navigation either compensated, or facilities that use navigation to be better reimbursed. So that's sort of state. And we are going to get to that in a little bit. It's a little complicated. Generally, we are here to support the patients who are treated in our system. Having said that, a big part of our strategic vision is to partner with our outreach, so care for that regional patient, which means, you know, we want to support patients across the community with resources to be treated in their communities wherever possible. So we want you to be able to reach out to one of us if you have a patient that you think could benefit from services and education and connection with resources that are cancer appropriate. The other thing that we hope is that we're also first in mind if you do have a patient who needs a higher level of care, a complex brain cancer patient, a patient who really shouldn't be treated in a community hospital setting and does need that we would be kind of first in mind for a connection point or an entry point into our system for those kinds of patients. Does that make sense?
Yes, it does. Thank you. Yeah, I understand better now.
Okay.
Thanks, Jess. Great question, Pat. Thank you. Because I have to say, we've talked a lot about this, and sometimes I think for myself, at least, I won't speak for Jessica, it's like, to me, I'm like, well, yeah, it all makes sense, but I don't know how others are receiving it. So thank you for clarifying and for asking that question.
Well, the picture of all the navigators and all of their affiliations all over the region, that was a good word picture for me of saying, oh, okay. I thought I kind of understood it, but I don't. So thank you.
We're all in the Denver metro area. We do have monthly meetings, and we'll get together in person and just kind of share and obviously do updates. And Jessica and I oversee all of them. And so it's a big group, and it's a really great group. And I think too, Pat, we're going to talk about this a little bit more, but you know, I'm always happy to be a point of contact. I know Jessica is too, but me being a part of this group, you know, I'm always happy to kind of be a point of contact and help guide in the right direction or get people to the right places. So, and then of course, we have some kind of more, I don't want to say formal, but some other areas that Jessica's going to go through. But I wanted to just real quick highlight, we've talked a lot about the nurse navigators, and we have a lot of really great programs. Something too that we're proud of is we have actually a group of cancer coordinators who focus specifically on our tumor conferences. And so we have quite a few, and I apologize, I'm not sure how many, but like 8 or so or 7 cancer coordinators, and they help support all the different tumor conferences for all the different tumor sites that we navigate. And then they also have oncology data accreditation managers who really oversee the cancer coordinators and help do the accreditation. So they really focus on our NAPBC. We are now the INCP, so it's the COC accreditation, but as a network. And then any other accreditations we're looking to get, they kind of support by that data. And keeping us all on our toes with our standards and things like that. So just wanted to put that out there because they really do a lot of work, and I want to make sure they're highlighted. So we have over 57 cancer conferences alone a month that we're running, and they're running all of those. So a great group. We are going to go back then to really that navigation referral piece. And this is kind of something that has been Jessica's baby, and also, like she said, just really wanted to highlight that partnership and then bringing patients back to the community. So I'll bring it back to Jessica. Thank you.
Thank you. So this sort of speaks to your question a little bit, Pat. And I wanted to say too, so this is a newer kind of initiative. We have been piloting it with a couple of different sort of facilities, if you will, regional facilities, but wanted to welcome you all to use this as a resource, and I'm happy to forward this sort of order form, if you will, to this group or to Star, and then she can cascade it down to this team. But that question about, okay, how do I get a patient to you is harder to solve than you would think. So, that's part of the solution we've tried to kind of create here. So we created this program that is care coordination and navigation for the regional patient. And the idea around this is that we would empower providers to treat patients locally wherever we can. So I do want to make that really clear. We want to support patients staying in their community. We also want to serve as a resource for providers and sort of the cancer community for if there are questions. So if a clinician wanted to bring a case to one of our case conferences to have a discussion about how, with different disciplines and clinical experts, about how to treat that patient, if possible to treat that patient locally, we want to be that resource and help. So a part of this intake form is to help connect patients with those clinical case conferences and connect providers to resources and clinical experts. We want to streamline for higher acuity patients wherever possible. We want to, especially for rural patients and for patients who are traveling a distance for care, a part of the goal of this program of partnership is if they do need a higher level of care, how can our navigators work to consolidate processes, consolidate the diagnostic studies and the patient appointments and any procedures to really reduce that impact on the patient for a financial impact, for length of travel, for dog care at home if they're traveling for care, things like that. Lots of resources we want to connect with locally and regionally. And then wherever possible after that acute care setting to return patients to their community and then close that loop with the providers in the local community. We're going to help consolidate those appointments. If they do come down to Denver, we're going to help with accommodations, transportation, any other resource to ease travel. We're going to promote remote management wherever possible. So where can we leverage technology and telehealth to keep patients in their communities and around their support systems? We do really want to ensure a closed loop. Some of the feedback we've had from patients who have come into the community to, for example, to the hospital, to the university hospital system, is that sometimes the local or community provider doesn't get that final closed loop. So biggest things to what we would ask, or what we're trialing, I guess, as a call to action, is to utilize this kind of referral form. This doesn't require a physician. This is, you can send this. And basically we created kind of a centralized e-fax, if you will. So you can send this form to this email. or you can, of course, reach out to me. This is my cell phone as we kind of get this program kicked off. What we ask for is some basic patient demographic information. If what the patient is really looking for is a second opinion, you can kind of click into this box up here, and that's what we know to help what we're helping to coordinate. And then things that basically the main diagnosis the patient is seeking care for, and then any types of appointments or specialists that the patient is requesting connection to. So also asking for any special considerations. What barriers to care do you know about already? What preferences do the patient have? Are they working? Do we need to try to accommodate a work schedule? Things like that. So I will forward this on to you, Star, and you can feel free to just please send it on. And if in doubt or with any questions or anything, please don't hesitate to call me. And then I'm going to hand it back over to you for some of the resources that are available, Brett.
Yeah, thank you. And we're almost done. I'm sorry about this, but we have a lot of opportunities and resources. So we use OncoLink. It's a great patient education portal or tool. So we can actually build a little education binder for a patient so they can leave their appointments with maybe some basic information on their diagnosis, treatment plan, education, and the different disciplines like radiation and chemotherapy. So we build that for them, or we'll send it out to the patients electronically after their appointment when they kind of understand more from the doctor. Wellness is something that we've invested in as a company, and it's been really great, but it's essentially a repository of resources, again, locally or nationally, for patients. So patients can either go in and build their own care plan, those that are savvy or want to stay more private, and then, or we can actually have a patient, like we can refer a patient to the program or to Wellness, which again is this resource or repository of resources, and the kind of call or experts on the Wellness side can build that care plan for them and give us those resources to provide back to that patient. Or else we can just go in and build it for them as well. But it's got, if you call in, there's over 200 languages. And again, it's got all the kind of main resources that are needed, but it's been great for our patients because I'm sure, as everyone knows, like transportation and housing and financials is like a huge issue these days. And so anything we could do to kind of help support the patients, we're trying to. We're not miracle workers, but it's we do our best, and sometimes it works out great. Lastly, we have this is another kind of way to get a hold of someone through Sarah Cannon. So we have this Sarah Cannon 24/7 hotline, I guess you can call it, but anyone could call, patients, anyone, providers, nurses, to just call. And if they have a question on, I know patients have called in before on just, hey, I have a lump, like I don't know what to do, and just kind of guidance versus second opinion. Some people call to get connected with a Sarah Cannon doctor for a second opinion. And so we have Lisa, who is a nurse, who helps take some of those questions that need to be, and she'll kind of triage and answer some of them if she can, or if they want to be connected, she'll connect them to either myself or one of our navigators. So she's another great person to kind of connect those patients to the right places. And making sure those patients either get in with a physician or just get their questions answered. I had one last week, and this woman was from New York, and she's coming here for treatment and was asking more about the prone position for breast cancer, and do we do it, and what is it like? And after talking to my physician, we do a lot of the breath hold versus prone, and so we set up a telehealth with her. to kind of consult before she even comes out here, so she knows where she's going. So it's just a really great process. I don't know. Sometimes it could be tedious, those cold trees always can, but so anyways, it's another opportunity to kind of help people and get that information out there that they need. And I think, I'm so sorry we went long, but that is our presentation. And we just, again, appreciate you all, and thank you again for letting us talk to you guys. And yeah, any questions, please feel free to reach out.